1. SARS-CoV-2 Neutralization Antibodies/IgG Detection Kit, Colloidal Gold Method. To allow the test device and specimens to equilibrate to room temperature, 15-30 degrees Celsius or 59-86 T, pour to testing. The kit consists of manual, dropper, disposable blood collection needle, test card and diluent. Extraction reagent and test cassette. Test procedure. Open the aluminum foil bag, take out the test card and place it on the desktop. Sample collection. Take out the alcohol pad and wipe your fingers carefully. Take out the disposable blood collection needle, puncture your finger, and use a dropper to take a blood sample from your fingertip. Put the liquid in the dropper into the sample hole of the test card and drop 1 drop of sample liquid. Unscrew the diluent cap, add 1 drop of diluent over the sample hole of the test card and start the timer. Wait for the colored lines to appear. 10 minutes observation shows the results, after 15 minutes, had no clinical significance. Interpretation. The result. The colored line in the control line region C appears and a weaker colored line appears in test line region T2. The result is low positive and neutralizing antibodies provide weak protection. The colored line in the control line region C appears and a stronger colored line appears in test line region T2. The result is middle positive and neutralizing antibodies provide middle protection. The colored line in the control line region C appears and the colored line appears in the both test line region T1 and T2. The result is high positive and neutralizing antibodies provide high protection. The colored line in the control line region C appears and no colored line appears in test line region T1 and T2. The result is negative, and no neutralizing antibodies in your body. You are easily infected with the novel coronavirus if you are exposed to the virus. Invalid result. If the quality control line C is not observed, it will be invalid regardless of whether there is detection line, as shown in the figure below, and the test shall be conducted again. If both the quality control line C and the detection line appear, IgG antibody has been detected and the result is positive. If there is only a quality control line C, the detection line is colorless, indicating that IgG antibody has not been detected and the result is negative. If the quality control line C is not observed, it will be invalid regardless of whether there is detection line, as shown in the figure below, and the test shall be conducted again. The used test cassette should be discarded according to federal, state, and local regulations. Limitations. 1. This test card is used as one of the auxiliary methods for diagnosis. The test results are for reference only and should not be used as the sole basis for clinical diagnosis and treatment. Positive results need to be confirmed by other method, limited by detection sensitivity. Negative results may be caused by antibody concentrations lower than the analytical sensitivity of the product. Clinical diagnosis should be combined with clinical examination, medical history and other tests. 2. The test results of this product are interpreted by human eyes and are susceptible to factors such as visual inspection errors or subjective judgments. Therefore, it is recommended to repeat the test when the color of the band is not easy to determine. 3. No or very low neutralizing antibodies to the novel coronavirus will result in negative results at the beginning of vaccine injection and should be repeated within 7 to 14 days. For patients with impaired immune function or receiving immunosuppressive therapy, there are limited reference values for serological antibody testing. 5. This reagent is a qualitative detection reagent and cannot be used for the quantitative detection of antibodies. 6. This reagent is used for the detection of personal serum, plasma, or whole blood samples. Do not use it for the detection of saliva, urine, or other body fluids.